is not just a number on a chart. It's a story. It's often invisible, misunderstood, and dismissed. For millions of people suffering from chronic pain, every day is a negotiation between what your body feels and what the world expects of you. And as someone who's lived through it, studied it, helped thousands of people overcome it, I know this truth intimately. Pain is not the enemy. Misunderstanding it is. Today, we're going to talk about unmasking the chronic pain, and let's dive in. So, why is pain so difficult to deal with? You see, chronic pain really stumps a lot of healthcare practitioners because we're all trained on the physical side. And so, if you go to a psychiatrist, they're trained on the emotional and mental side. What we need is to bring that world together. And so, when you're looking at chronic pain, yeah, you may have a physical component with that. Maybe your knee does have an injury there. Maybe your elbow does have an injury or your hands have an injury. But the real problem with chronic pain is this continues to linger. Mentally, it starts to mess with your body's ability to heal itself, number one, because the fear and frustration of you maybe fallen or what your life may look like down the road, because not only have you been dealing with this for a week, dealing with something for a day or a week or even 2 or 3 weeks is not a big deal. But when you start getting into something that's more of like 3 months, 4 months and longer, all of a sudden you start to feel hopeless and you start to have the fear of what your life's going to be like down the road. And so one of the things that separates what I do here versus what most people do is I'm really combining that emotional world into the physical world. So most of the time when I get someone coming in, I usually get people who they've tried everything. I mean, they've been to every type of doctor known to man. They've tried every type of a therapist. They've tried pills and injections and all kinds of braces. And they've even got desperate enough to buy things online that promises them the world, only to realize they wasted their money in many cases. And part of the problem there is even from the public sector, what's happening is that they're focusing on just the physical part. If I can solve my knee pain, if I can get my hand grips back, or if I can get the neck pain out, I could stop all that. My life would be great. And it feels like that. And it's like, so you get a pill and maybe it subsides it for a while. The problem is it comes back. And so then you have the fear of it coming back because now it's come back and yeah, you can take this. And how many times have you taken pills or injections and the first 1 or 2 times that you did it, it worked wonderfully. But then over time, as it kept coming back, it had less and less effect. A lot of us had been in those situations. And so one of the things that I found with the stretch and release technique was that by combining the emotional side to it, with the physical side of actually stretching and self-massage, now what happens is that, yeah, we're addressing that physical side because we're getting the muscles to relax by getting the brain to relax. So you understand that when you're dealing with chronic pain, what happens here is that hopelessness, that fear that's going on in your brain will cause the muscles to tighten for fear that it's going to get worse. So you're stressing out. And so by doing that stressing out, you're making the muscles tighter. So if there is a physical issue, you're going to make that physical issue worse. Let's say you have a bulging disc, a herniated disc, a pinched nerve. 99% of the time, what's causing that are the muscles around the vertebrae that for whatever reason, they've gone into a spasm. They're contracting around the vertebrae that's pressing unevenly in a lot of cases on the disc or on the nerves, and as it does that, it creates pain. Now, the worst thing somebody can do is you go to a doctor and they're running test after test after test, and they're like, I don't know what it is. I don't see anything. And you understand, they're coming at you from a physical point of view. It's not that they don't care. Their training is not that, you see. I mean, even my training, even in massage therapy, you would think, massage therapy is about relaxation, but in reality, it's really about teaching you how to do a massage protocol. And it's like when you start to delve into the mental aspect of someone laying on that table as a massage therapist, for instance, or if you're a doctor or a physical therapist and that person on your table that you're working on there, when you start to engage on the emotional, mental side, that can tell you a lot about what happens. So here's some things to think about. You see somebody, think in your mind about somebody who is depressed, somebody who is sad. Question in your head is, are they standing up straight and erect like somebody who just won the lottery? Or are their shoulders slumped in? Is their head slightly leaning forward? Are they having a shorter gait? In other words, they're walking pretty slow as they walk down. Are they slouching in a chair? And you see just that state of mind, all of a sudden you start to change the posture of the human body. Now all of a sudden, the head leaning forward with the shoulders rounding, you get pain on the backside of the neck, which actually causes pressure on the vertebrae, a lot of times unevenly, which could lead to bulging disc, herniated disc, and pinched nerves in the cervical spine area, which would be the neck. Then the same is true into the low back when you do that as well. And as that person is slumping over, now all of a sudden you have the whole upper body leaning forward in front of the belly button, so to speak. And so now you start to put the hips and the knees into a strange position and can cause them to wear out unevenly. If you're talking about a person who is angry all the time, someone who's high strung and they just really go, 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 go kind of thing, that person now is their muscles are tense all the time, compression on their joints because all the muscles are passing over joints, so they're compressing on the joint. They're increasing their heart rate, they're increasing their blood pressure, and they can't sleep that well at night because they can't slow the brain down. And it's like, so you can start to see then in that person health issues coming down the road, that if they can learn lifestyle habits that can change that, the same thing for the sad person, now all of a sudden you might be able to avoid the heart disease, you might avoid high blood pressure, you may avoid joint injuries by being able to make those little lifestyle habits. Now, the one thing that when I get into the stretch and release technique, and the one thing I learned with that is that as I combine this specific style of stretching with the specific style of self-massage, and then bringing in the emotional side to that so that your mind can let go as you do these things, two things happen. Number one, mentally you start to relax, and then that brings your heart rate down, brings the blood pressure down. Number two, as you relax, the muscles start to release the tension off of the spine, off of the joints. You start to see your body moving better than it's ever moved before, and that starts to build hope and confidence in your body. Now, this is not a miracle. I mean, the thing is you're not going to cure cancer with this. It's not a miracle, but the point is that as you practice this every morning and every evening, you're giving yourself brain breaks to reduce the amount of chronic stress in your life. You're reducing the amount of physical stress in your life on your body as well. And all it takes is 15, 20 minutes at a time. And so that's really, as I'm talking about in these videos about doing the stretches, I used to have a professor, she would call us the Chekhov Society. You tell somebody to do 10 repetitions and it's like, boom, 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 boom. Okay, I did my 10. And the thing is you have to think about it. You have to think about it and be aware. Take the time to just let go mentally so you can let go physically. This body is reactive, and it reacts to whatever's going on up here. The mind and the body is connected together. You have a vagus nerve that you get messages from your ankles, your toes, your knees, your hips that run through this vagus nerve up to the brain that says, whoa, high alert, my ankle hurts. And the brain then sends a message and say, okay, this is what we're going to do. But if that message comes up to the brain and the brain is so rattled because you can't slow your mind down, the brain then just loses it from overwhelmment. And then everything in the body then starts to tighten. And as it starts to tighten, not only now does my ankle hurt, but all of a sudden my low back hurts, the middle of my back hurts, or my elbow hurts, whatever the case may be, as you continue to live that kind of life. So one of the things when you talk about unmasking the pain, you have to bring the physical world with the emotional world, bring those two worlds together. In other words, reconnect the head to the body. And then once you do that, now you can reduce that amount of pain in your body and you can move forward. Remember, when you're trying to unmask pain, it's not just a physical thing, it's also an emotional thing. Keep that in mind, keep listening, and let's go have fun. Don't forget to subscribe here. If you want to go deeper dives, I've just started a new newsletter on Substack. Go over to the Muscle Repair Shop on Substack. We can get in, build a community. Let's start changing the world one person at a time, and let's start with you. I hope you enjoyed this last video. Be sure to click on the video here to my left and enjoy.